Hi fitness friends, bringing you here a quick video regarding hip mobility relative to core strength and core stability. I've got Starvin Marvin here. He is making his debut today. I thought it was important to share a little bit about basic anatomy. I think that that's very important to understand kind of how that body is made up and how it is meant to function, so we can understand, we can put that with then our muscle patterns. So I'm going to start here with the hips, of course, and this is the pelvis, bony structure, and this is the hip joint. This is where the leg bone, the femur, comes into and attaches to that pelvis. So these are the ilium, or what I call the butterfly bones. I refer to these a lot in yoga classes because it's just a bony landmark, and I invite you, if you kind of palpitate, you can feel the butterfly bones. Coming down from those butterfly bones, we've got the pubis, pubic bone. Spinning him around here, we've got coming down from the ilium on the back side, posterior side. Here, these are the sits bones. Of course, coming down, sitting bones, or they're also called ischium. Ischium, sitting bones, that's what we sit on. Also back here, we've got our low back or lumbar spine, the bottom 5 vertebrae. And then we've got the sacrum, which of course turns into the tailbone. This here is our SI joints, or sacroiliac, and this is where the spine and the pelvis connect. There's tissue, there's fascia, there's tendons, there's ligaments, and this part of the body here, we always got to focus on low back stability, because that part of the body has only about this much movement. So that makes a lot of sense when we talk about low back pain and about low back tension, because if we're moving more through our back and this is not stable, because our hips aren't moving as well as they could, again, it's understandable then how or why we would feel that low back pain or tension. So we want stability here, and we want mobility in those hips. So the 3 ways that our hips move, we've got flexion and extension. Flexion, think about doing a knee lift, or if when we sit, we have got our hips flexed. And as we walk, hip extension. Let me back him up here a little bit. Hip extension becomes very important. Think about when we walk and that leg swings behind us, and then our foot rolls from our heels onto our toes. That's the propulsion phase of our gait. We need a strong posterior chain, primarily those glutes. I talk a lot about glutes as well. Glute maximus, those are our prime movers for hip extension. We need a strong posterior chain to push us or to propel us forward. Without that strong posterior chain, what it might feel like is we're dragging our leg, or it might feel like we're walking with a peg leg, because we just don't have that good flexion and extension going on in the hip. Second way here is adduction, abduction. So think about doing a side leg lift, and as that leg comes back to that midline or slightly crosses over, that's adduction, abduction, adduction. And then the third way is external rotation and internal rotation. And again, that happening here from the hip joint. If our rotation happens from our ankle and or our knee before it happens in the hip, chances are we're probably going to have some problems with those lower extremities, because again, that movement is available, should be available to us from the hip. We don't really have that movement all that much available from the knee and through the ankle. The last thing here I want to point out is the placement here of the pelvis. We do have a normal 10% tilt, or 10 degrees of anterior pelvic tilt. A little bit is good, a little bit we want. It's when we get into excessive anterior tilt, or the opposite of that would be a posterior tilt. I always use the analogy of the hips, or of the pelvis here, like a bucket of water. And if your bucket of water is spilling and we're not flexing, we're not bending over, again, we've got all of the muscle structure on the front side and the back side having to hold everything in place. So again, a lot of our low back pain and tension, sometimes it can be because of the mobility that we don't have available in the hips. So with that said, I'm going to show just a couple of movements here to kind of focus on hip mobility and see where you're at. So I'm going to move Starvin Marvin out of the way here, and I'm going to come into standing. And I'm going to back up here a little bit so you've got all of me, or pretty much all of me, in the camera here. Okay, so standing up nice and tall, nice and tall. We want to think about, again, nice and tall, pelvis like that bucket of water, and coming into this knee, lifting, flexion, extension, okay? And then the opposite of that would be, I'm going to turn to the side, I'll do a few sets here to the side, and then opposite of this, of course, would be that hip extension, reaching behind. So we know we have some pelvis tilting in there, and I'm going to over-exaggerate it so you can see it clearly on the video, that as we lift, if we do this, if we have to do this to get this knee to lift, then we are, our hips a little bit stuck. Or as we go backwards, same thing, and we're doing this. So we kind of feel the ribs flaring, we're maybe overarching the back. So we want to try to move in that hip flexion and hip extension. So if we have to start small and work in that range that's available to us, that is the place where we want to start. Now, I'm a firm believer that with being very mindful of our movements and in getting really good at feeling our movement in our body, what's moving, what's being quiet, when we get really good at that, we can feel when our body is compensating. Now, we compensate a lot, all the time, most of the time in daily life, but it's that repetitive type of compensation that really can get us into trouble. That can cause that muscle imbalance. A muscle is long and weak, or short and tight, or vice versa. And so it's those imbalances that create that pull and that tug in the body, and that ultimately then can lead to pain and tension. So that's a little bit of focus on the hips as far as movement goes. Now I want to focus on a couple of strengthening exercises. So I'm going to come here into or onto hands and knees, flat back or neutral spine we call it. In yoga we call it tabletop. And I'm going to start here with some belly breathing. So now we're going to start to integrate the core strength or core stability. And I'm pointing at Starvin Marvin here. The core strength or core stability. So with coming into some nice deep breathing without doing this, again, I'm going to over-exaggerate this. As I inhale, a person might want to round their spine, or what we call flexing or flexion. And then as we exhale, kind of sinking that belly, sinking the belly button, or what we would call hyperextension. So we've got flexion and we've got extension. We want to try to come into full deep breathing without adding that movement in through that spine. Now, if you've got the strength available through your arm, through your shoulders, I would even encourage you to go ahead and place the hand here on the pelvis and do some nice deep breathing. And if you can, even pop in front of your phone or have somebody video record you and see if that spine, if your back is moving. The other exercise here, one other exercise to start with, is our spinal balance. And again, if you attend any of my yoga classes, you know that we do this one a lot. We're going to take one arm and the opposite leg. So I'm going to use my right arm, left leg, go ahead, extend it up, and then go ahead and bring it back down. Nice tabletop position, and then switching sides. You want to imagine having your favorite drink on your back, coffee, hot chocolate, tea, whatever it is you drink, and it's on your back, and you're able to move through your hips and through your shoulder joints, trying to maintain that flat neutral spine, all at the same time while maintaining that strong deep belly breathing to really focus on that core and back stability. Now that, of course, working core and back in that way, we call that isometric training. Crunches are okay. Any type of core exercises, again, not a bad thing, but I think sometimes we forget about the stability and the strengthening that should happen here through that core and that back. And that happens in daily life from most of the time from a standing or a seated position. So I encourage you to play around with those exercises from standing to kind of focus on that hip mobility. Start with that, see what's available, see what range is available to you, and then also start with some belly breathing and some spinal balance for core and back. I invite you to leave any comments, ask any questions, and look forward to seeing you on the next video. Thank you.